So now we're going to look at clearing the right lower quadrant, or the leg, the right leg. And to do that, I want to show you a diagram here of what we're doing, so that kind of understand a little bit about where the fluid has to go. To begin with, we'll be working in the belly, because the belly is going to carry a burden of a lot of the fluid that we're moving up through the leg, and that fluid is at the base of the thoracic duct. So we'll be clearing the belly first, and then after that we'll be clearing the same side in the armpit area, the axillary region, and then we'll be clearing this whole pathway from these inguinal nodes on up to the axillary lymph nodes. So we're clearing this pathway, and once we've cleared that pathway, we'll be working in the opposite inguinal node region and clearing those lymph nodes, and then moving the fluid across the lower abdomen. So after that, I guess we're ready to begin. I want us to first focus on clearing the abdomen. And to do that, I want us to put your hand over on the left-hand side here, and we're going to scoop inside your belly, just into the belly and relax, and into the belly and relax. 5 to 7 times will work okay here. So you're clearing here 5 to 7 times, and then after we've done this, we're going to work just above the hip bone and just into the belly and relax, and into the belly and relax 5 to 7 times. And after we've done this side, let's move over to the opposite hip bone, and you're going to move that in and relax, and in and relax, and in and relax, and in and relax. So 5 to 7 times there. Now move underneath the rib cage and push that in and relax, and in. Just push that tissue into your belly. Just push it in and relax, and in, relax. 5 to 7 times there. And then once we've done that, we're going to walk to the center, and that fluid is just, we're going to push the top just as above your belly button. We're just pushing in and relax, and in and relax, in and relax. So you'll do this about 5 to 7 times. And lastly, we're going to work underneath the rib cage on the other side, on your left side. In and relax, in, relax. And I find using 2 hands kind of works, because sometimes one arm might be stronger than the other, or one hand is able to kind of grip the skin a little bit better than the other, and one is kind of your power. So now we've effectively gone all the way around the belly, pushing that fluid in, and now we're going to follow up with some deep breathing. So put your hand over your belly button and put the other hand over your belly button. What I want you to do is take a good deep breath, a big abdominal breath. Breathe in through your nose. And as you breathe out, I want you to push your hands and exhale. Now hold that fluid, that pressure if you can, and breathe in. And move your hands over to the left side of your body. And before you exhale, I want you to push, as you exhale, push that fluid out. Good. Now hold that pressure and breathe in. And move on back to the belly button, and as you exhale, push in with your hands. All right, hold that pressure and breathe in. And now move your hands over to the other side and push in. Hold that pressure as you inhale, and finish up by going to the belly button. And let's do that one more time, because this is going to be taking a lot of the lymphatic fluid. Now, where does that fluid go? But it goes up above our collarbone. So let's activate that area. And what I want you to do is sit up a little bit straighter if possible. And we're going to do 5 to 7 stationary circles, or circles with our shoulders. So what we're aiming to do is move the shoulders up as high as you can, and back and down. Okay, so let's go up and back think this is 3, up and back and down. Up as high as you can go. This will activate the area where the lymph fluid goes into the bloodstream, just above the collarbone. So we're going up and back and down. Up and back and down. So 5 to 7 times here should be sufficient to activating that area. Up and back and down. Excellent. So now let's begin with clearing the same side axillary region, or your armpit. It seems kind of funny. Why are we going to the armpit? But remember from the diagram that I showed at the beginning, there is a pathway between your lymph nodes that you have in your groin here and the armpit area. So let's just clear by putting your hand just gently, and you're going to do some stationary circles, moving that fluid up into the armpit. And you can go 5 to 7 times here, just clearing that armpit. You might want to move your hand around a little bit. You can move above your armpit, moving that tissue kind of in the direction of your heart. And in, and just beneath the armpit, you can take that and just move it on up. Okay, so now once we've cleared the armpit, we're going to be moving the fluid, and we have to start closest up here because we want these vessels to be empty. If this fluid underneath the armpit is emptied, then there's some place for the fluid from below to go. So we're going to move this up. Now look at the stationary circle is going upwards in the direction of the armpit. So you can go 5 to 7 times here. And it might work that it's easier to do it with 2 hands. And once you've done that, you can work in the middle of your body. Stationary circle where you're lifting up to the armpit and down. Lift up and let that skin rebound down. Up and relax. And up, relax, up and relax. And then once you've done that, you're going to go right up here, kind of on the side of your hip bone, just moving up. And then I think we'll just kind of do a little follow-up all the way up to your armpit. Next, we're going to take a look at clearing the opposite nodes in the groin here. We call these the inguinal nodes, and they're located right where your leg runs into your body, right in this area. So let's just take a look at putting your hand here and doing a circle where you're pulling up towards your belly button or pulling up towards your stomach, and relax. Let that skin rebound and pull it up and relax. And you can, there's a lot of lymph nodes that are all in this area, so we can actually pull that skin up and relax, and up and relax. And at home, if you are able to do this just on skin, probably the better. The better they're able to just put your hand right directly on skin, you'll get less sliding along the skin. So once we've activated and kind of cleared these lymph nodes on this side, then there's this pathway that we have just above your pubic bone here. And let's just clear this side with your fingertips down here. You're going to just pull in the direction of the inguinal nodes that we just cleared here. So let's go 5 to 7 times on this side. Notice how I'm on the left side of my body. So I'm going to clear that 5 to 7 times. And now once we've done that, we can go in the middle of the body, clearing there. And now we can clear over here. Notice it's a stationary circle. We're just moving the direction in the direction of our inguinal nodes over here. Push, relax. So once we've completed 5 to 7 times there, and we've cleared this pathway, now we're ready to begin clearing clearing the leg. And on the leg, I want us to focus on first clearing the outside portion of the leg. To do that, let's put your hand on your outside side of your, and you're just going to put your hands here and lift that skin up and relax, and up and relax, and up and relax, up and relax. 5 to 7 times there, and then you can just take your 2 hands and move them on your leg up. So we're moving towards the direction of the top of your leg, and relax, and up and relax, up and relax. And again, what we're looking at to know if you're being effective here, we're not squeezing with our fingertips or anything, but we're really moving the skin. So if you can see the skin moving around your kneecap, that will show you that you're doing the right thing. You just want to take that and move that up. So 5 to 7 times in the middle of the leg, and then we can move to the side of the leg, 5 to 7 times here. So we've essentially covered the outside portion of the leg. Now we can cover the inside of the leg, and we can move that fluid, the tissue, to the outside of the leg, because that's just how the leg will drain. So just take your tissue and move it to the side, 5 to 7 times at the top of your leg. And then in the middle of the leg. And actually, I mean, there's a lot of different ways you can do that. We just want to move that skin, move that tissue to the outside side of your leg. And then we want to follow that up by moving it in the pathways that we've already cleared. So we can take that and flush it basically up the side of your body. And sometimes I think this is easy. If you're lying in bed, you might find it's easier to just be able to reach the side, and you can move that fluid on up to your armpit on this side. Or again, we can take that pathway that we worked across before, where we're working across the groin over to the opposite inguinal node region. So we've worked the outside part of our thigh, we've worked the inside to the outside, and now the magical move, I think, behind the knee. When you have swelling in your leg, hopefully you can reach your knee, but if you can put your fingertips together and just gently and comfortably hold on to your knee, and what you're going to do is pull that skin up towards your body, pull it as hard, as where you can pull it, and then relax, and up, and relax. Now, as we're talking about this, you will know at this point by what you've talked about with your therapist or your physician as to whether or not you've had primary or secondary lymphedema. If you've had primary lymphedema, you can also really work the lymph nodes that you have here and take that fluid that we just moved from your thigh. You can move it into your inguinal node region. But when you have secondary lymphedema and the lymph nodes are not just functioning there as they should, another also effective way, as it is with primary, you could do it as well, but you can use the lymph nodes in your groin, is to, with secondaries, to move up these pathways that I've demonstrated to you already. So here we are. We're at the knee, and we're just moving that tissue up and around. So if you can see, I'm kind of doing a circular motion, and I'm just taking that skin and pulling it up gently and relax, and up and relax. So 5 to 7 times behind your knee works great. Now sometimes you're going to just want to work over the knee, because sometimes this area is also very swollen. So you could just, do a stationary circle over your knee. And again, you can work that then pulling up the side of your leg. And and then working it up to your armpit and working it over to the inguinal nodes. Another area, you can work on the side of your legs. Well, we did the side of the legs here. We can work in this region, and a lot of patients sometimes say that they have some pain or they feel something here. Well, this is a bottleneck where a lot of lymph vessels from your lower leg come together. So I would say just take both hands if you can. And we're just, again, doing a stationary circle where we're pulling up towards the top of your leg and relax. Up and relax. And up and relax. Up and relax. Notice again, we're pulling on that skin. We're stretching the skin, because by stretching the skin, you're activating the lymph vessels that are just beneath the skin. So you really want to focus on stretching the skin till it's max. And we're never pushing back downwards, we're just letting that skin rebound. So once we've done this bottleneck area, then we can work, if your hamstrings will allow, you can actually just take that same circular motion where you're cupping your leg, if you can, and you're pulling it up and relax, up and relax. So you can go 5 to 7 times here. And then you can go 5 to 7 times here on your calf, mid-calf, up, relax. And then down by your ankle. So you're just really wanting to pull that skin up, and then you always have to remember to keep flushing it out of there, so that you're flushing it back up into the nodes behind your knee, and you can also then flush that all the way up the side of your body. And so this might be a good point in the tape where you can pause it, and you can work at flushing that fluid on up to the axilla or over to the inguinal nodes. Now you can work on the top of your leg. Sometimes there's a lot of fluid here, because essentially before we worked almost 3/4 of your leg this way by just pulling up this way. And now you can work on the top of your leg and the front of your leg, and then you can work in the middle of your leg, 5 to 7 times there. And then down by the ankle. And this, sometimes there are rolls, there are areas, so maybe it's a little thicker, so it's perfectly okay to take a look at massaging this area a little bit more, spending a little bit more time. And if you need to do that, again, pause the video. Just focus on moving that skin right at the junction between your foot and your leg. And then we both have our ankles to deal with. So we have behind the ankles here, and you can actually take your fingertips and you could do some stationary circles behind the ankle here. So you could do 5 to 7 times on this side. Again, then following up, flushing that fluid on up the leg. Because essentially we want to get that fluid out of here, right? We want to get it out of this quadrant and into the axilla or the inguinal node. So you can follow up, what we call a follow-up move there. But you can work on this side of the ankle. We also have this side of the ankle that you need to work on. So you just take this, and best you can, you just want to stretch that skin. You can work you could work both sides. Just really trying to get that skin behind the ankle bones to stretch. And pulling that up, and then following it up. Up your leg, up your leg. Now, once you get down to the foot, you can put just a flat hand on top of the foot, and you're just going to stretch that skin. Sometimes the foot gets a lot of fluid here, and it's quite puffy. So it's very helpful to just stretch that skin, or you might find that it's effective to take the fingertips and stretch between the bones in your foot, moving between each of those areas to kind of just work that fluid. And sometimes this fluid might be a little stubborn, so perfectly fine. Spend some more time here just breaking this fluid up and then flushing it out of your body up to the axilla and over to the inguinal nodes going up your leg. So right now what I'm doing is taking my fingertips and just doing some stationary circles between the bones in my foot. Again, you can just do flat fingers, flat hand, pulling it up and relax. And then you can follow up with the toes, taking your thumb and doing a stationary circle, working at the base of the thumb, base of the toe, and then working up to the toenail, tip of the toenail, and then sliding it on down. We're working at the base of each toe with stationary thumbs, circles using my thumb, and sliding on back down. I can go back to the next toe, stationary circles at the base, then in the middle, and up by the tip and the nail, and push it on down. And at the base, and by the tip, and then slide on down. And then you've got the little toe, base. That's generally pretty small that you can just work that on down. So now once we've covered the foot, and again, usually the fluid in the leg can be so stubborn and thick that you may need to spend a little bit more time than what I'm demonstrating here. So at any point you can really work on an area that's the problem area for you, and then continue to always flush that fluid up, either to the same side, axillary or armpit region, or the opposite side to your inguinal nodes. But see here, I'm just stretching up. Now, sometimes you'll find that your skin, as much as you try, you are sliding on the skin. And sometimes what happens is your skin is just super dry, and lymphedema will do that to you. The protein in the fluid will actually kind of zap some of the fluid that you have in your skin. So it's good just to moisturize and make sure that you have just a little bit of traction in your skin so that there's something that you can actually pull on the skin. You don't want it so much so that it makes you slide, but rather, just so that there's enough moisture in your skin that you can do effective pull, a stationary circle pull on your leg. So here I'm just pulling up from my ankle up, just working it on up, and my goal here now is to work all the way up my leg, and then up my leg, pulling that tissue all the way up, working up my leg. You can push that fluid from the inside to the outside. And pulling that tissue up and up your leg, up on the hip, around the hip. Again, if you have primary, you can go right into the inguinal nodes here. But if you have secondary, let's work on going around that area, go on your side of your hip, and then working on up your body here, just moving up to your armpit region area, the axillary nodes, as we call them. So you could do that whole sequence a little bit more, just really working at flushing that fluid out of this quadrant up to the armpit, or we can take a look at moving that fluid across the body now. So stationary circles in the direction of the inguinal nodes on the opposite side. So we can go 5 to 7 times here. We'll go in the middle. And on the side. Okay, so we've effectively done manual lymph drainage on our affected leg. We've pushed it over to the opposite inguinal node. We've pushed it up to the armpit. You'll need to ask your therapist if by chance you have swelling in your other leg. Perhaps you might not want to move this over, and just discuss this with your primary therapist. But you can move it on up to your affected or to your unaffected armpit. And then to complete, we want to do some breathing. So let's put our hand back on the belly. We'll do some good abdominal breathing, because a lot of this fluid now is going back up into the gut. So let's just put your hand on the belly. Take a good deep breath in through your nose. And breathe air out. And breathe air in. And breathe air out. And another way that you can do it is when you breathe air in, almost think like you're fogging up a mirror. So you're really exhaling and expelling a lot of that fluid. So let's this time really go for it. Really heat up that mirror. And again. And there you've completed the manual lymph drainage for your right leg. Congratulations.